Hi, my name is Dr. John Schultz. I'm part of the Centennial Schultz Clinic, and today we're going to talk about a meniscus injury. What is a meniscal tear? What are the treatment options? In this video, I want to review what a meniscus is, what a tear looks like, and what are the treatment options. Simply put, the meniscus is a shock absorber in the knee. We each have two, one on the inside of the knee and one on the outside. It starts from the very front of the thigh bone and goes all the way back to the shin bone. And what it does, it absorbs all of our energy. So when we jump, when we launch, when we twist on that lacrosse field, when we dive for that soccer ball, this is what's functioning. But so too, when there's a tear, ouch! With every single move, with every single launch, this can be unbelievably unbearable. So you've been told you need surgery for your meniscal tear. They say they're going to repair it. 99% of the time, it's not a repair. In fact, all it is a cut of a large part of the meniscus out. So now what was a perfect shock absorber has an incomplete circle, and this will not work. This is not temporary, this is permanent. What are the consequences of a meniscus surgery? There are many. The knee can become unstable. What was normal in terms of function now can be unbearably painful. With twisting and turning and jumping, it can be very, very painful as a result of surgery. This is a little demonstration of the meniscus. This cushion, this little wafer between the thigh bone and shin bone. And now with a tear, it's much more susceptible to injury and a cause of pain. So now, rather than functioning as an appropriate shock absorber, it bows out. Ow, ow, ow with every step. And then the two bones, the thigh bone and shin bone, slam together, contacting each other. What else can happen as a result of meniscal surgery? Is the meniscus is now at risk for more tears. So the very surgery that you have puts you at risk for more surgeries and more cutting away of the meniscus, which then predisposes you to more injury. I'm Dr. John Schultz of the Centennial Schultz Clinic. We've treated thousands of patients with meniscal tears with precise injection of platelet and bone marrow concentrate cells. We know we can help you too.